My name is Meriam. I'm a specialist registrar based in Moorfields Eye Hospital in London, predominantly based in the south of London. My current role as a Topol Fellow involves the use of technology to empower patients to own their own eye healthcare needs. We do this through home monitoring of visual distortion of macular disease in patients who are diabetic. And my role predominantly involves communicating with and educating patients about the use of this smartphone-based technology for this purpose. And it helps us and them understand the fluctuations that occur in their vision between their fairly static hospital appointments. And it's been a fairly eye-opening experience, if you'll excuse the pun, and it's been a real privilege to be able to work with patients to help them understand their sight. The way we now work is entirely different. As clinicians, we've needed to be quite dynamic and adapt fairly rapidly to the situation to ensure the continued safety of our patients. And we've done this through essentially harnessing technology that was already present to allow us to perform more virtual reviews through video consultations, telephone consultations, to enable us to connect with our patients from afar without needing to bring them in and put them at risk during the pandemic. Home monitoring is now of paramount importance. With the need for the reduction of in-person contact and the very great importance of identifying patients at risk of visual decline early, remote monitoring provides us with a way to identify those patients early and have a direct line of observation and connectivity with our patients, allowing us to detect worsening vision early and essentially being able to implement treatments promptly before they're allowed to deteriorate to what you might say is a critical point. And crucially, during this time, it allows us to bring in those to hospital who only need to come in. But even outside of pandemic times, patients don't want to be coming in regularly, and if you can only bring in patients when they need to be seen and detect worsening vision early and ensure that you're always seeing the right patient at the right time, you can have a huge impact on the healthcare system and on patients' lives. I really do believe that telemedicine is the future of healthcare. And although these uncertain times have been so very difficult for so many different people, it's given us an opportunity to put into practice changes that perhaps were long awaited and to harness technology for the good of our patients. But this situation has really forced our hand. But now that we're here, there are benefits for our patients and for our healthcare delivery system, and all the traction that telemedicine has gained and will continue to gain, I think will only increase exponentially. And no, I don't think we will all be replaced by robots.